This woman, a resident of Budada village in Bududa district, went into labor in the wee hours. She alerted neighbors who quickly organized a locally made stretcher to carry her. A group of able-bodied men rushed her down the slippery dark path to She Health Center 3 for delivery. The fact that this is a hilly district with no feeder roads means that the transport and access to social services is a problem.
Patients from those upper areas, they are just carried with other, we call it stretchers. Yeah, they are transported on stretchers by the very people of the community. So they move with them from those uphills. When they reach here at times, if there is no rain, like during summer seasons, they use motorcycles. But now it is the rainy season, so they can as well move from the whole of this distance up to the health centers. They can move as far as even up to Bududa, where there is in the main hospital.
We had some NGO that gave us a few stretchers that they put on their heads and then come down. But because of this big population, they are not enough. So they just locally organize their own with banana fibers and the sticks, and then they just carry the patients here. At times they bring them when it is a little late, and there are those that we may not have to manage from here and we have to refer to Bududa.
They carry the patients on heads or actually on wire mesh. You cannot use a wheelbarrow because the complicated mountainous terrain of Bududa cannot allow you to use a wheelbarrow. But in the 21st century, with advanced technology, it is possible to make roads to those places.
She Health Center 3 caters for a population of over 20,000 people in the sub-county.
But those are within the catchment area of Wushi sub-county. And there are others that come from the neighboring villages, like Bumayoka, Bumalukani, Bumasata, that is next to Blucheke.
The potential would be that now would actually achieve the millennium goal of reducing on maternal mortality rates. We are having a high number of our mothers dying.
The facility receives at least about 5 expectant mothers daily.
The challenge is actually that we are overwhelmed with the number of clients. Like when you came in, actually phoned me the other end. I have a crowd of them, and sister was managing these ones here. But the biggest challenge is they find it difficult to get down from up to here and getting back. So it's a little bit difficult for them.
Health workers conducting outreach programs in the villages find it very hard, especially in the rainy season.
The place is hilly, but because we want to offer services to our community, we have to make sure we reach there. We have gumboots and umbrellas, so we have to make sure we go there. When rain gets us up and you're in gumboots, at least you can make your way down. But if you've not reached there by that time, then you'll face a big challenge. You'll not get what you want. And so we move there a bit early before the rains come.
What could help us most would be possibly establishing another health center a little bit higher, so they can easily get there, and maybe health workers will be stationed in that place, and it could be easily possible for them, for the patients.
The people here say the government should look into constructing a health facility that is easily accessible. But if there is no road, selling building materials will be difficult. The land here is fertile and the residents grow bananas, Irish potatoes, onions, and passion fruits, among other crops. However, getting the produce to the market becomes another uphill task, as the villagers carry the heavy sacks and baskets of food to and fro on their heads.
The government could come in. This road would help us to access the good price for our products. For example, we grow onions here, we grow cabbages, we have matoke in plenty, and many other produces. So if the market, if the transport could be access to our communities, we could be able to sell our products, and we get the income that would help us to improve on our livelihood.
How are you? I'm fine.
Where are you going?
I'm going to Senda.
Where have you been?
I have been at Budada.
So what are difficulties that you're facing? Because you're carrying these things on your head from up there up to the thing. How many kilometers do you walk?
I'm moving as for 20 kilometers.
What do you want government to do for you to be able to stay with it?
I want government to give me help so that I may be able to learn, to study, and then get a better life in the future.
What about a road? Would you like a road? Speak about the road.
The roads. The roads. We need to have the better road so that transport can be here for us to transport these things.
A protective agricultural area. They produce onions, coffee, matoke, and other products. So in case the government can link them with road networks, it can be easy to transport their produce up to the marketing areas.
Local leaders have asked the government to construct access roads in the hills to make transport easier. Agnes Nandutu, NTV, Bududa district.